All right, let's go. Today's topic is on signs and symptoms of pregnancy. Now, to begin with, the signs and symptoms are divided into three basic findings according to research, and these are what we call the signs which are felt by the woman herself, not the signs by, of course, the physician or the doctor or any midwife, but of course the signs that are felt by the woman on herself. And these are termed as the presumptive signs of pregnancy. So basically, these are not the true signs of pregnancy, but they are the earliest signs in which the woman is going to feel or otherwise think or begin to fear that they might be pregnant. The other basic finding is the signs which are seen on physical examination by the physician. And these signs are termed as the objective signs. And as well as that, there is also the signs, the true signs of pregnancy, which are going to be observed by investigations or laboratory findings. So to begin with, we are going to start with the signs felt by the woman herself. Of course, as we know, these are not the signs, these are not the true signs of pregnancy. So the signs felt by the woman, we call them the presumptive signs. And the first sign that is going to be felt by the woman, the first thing is amenorrhea. Probably this is an English spelling. So amenorrhea is the first sign that the woman is going to, in other words, they are going to be suspicious of pregnancy. So what is amenorrhea? Now, amenorrhea is the cessation of menses in women. So this is the cessation of menses, or otherwise the stop of menstrual periods. A lot of factors can cause amenorrhea, but in this case, we are not sure that the amenorrhea is either as a result of pregnancy or as a result of other things. That's why we term it as amenorrhea, because it's the cessation of menses, and this is the first sign of pregnancy, amenorrhea. But we are not sure, we are not certain, we have not done any investigations, so we can't be certain that the woman is pregnant, because as well as pregnancy, besides pregnancy, there are other factors which can lead to amenorrhea. So for example, excessive exercises, brain abnormalities, anemia, diseases such as tuberculosis, HIV and AIDS, all such things can contribute to amenorrhea. Now you might be surprised why I've included tuberculosis on the causes of amenorrhea, and this is very important clinically because tuberculosis is said to lead to a lot of causes of amenorrhea, and if not treated properly, tuberculosis is one of the causes of what we call infertility. Because of its interfering with the endometrium, the inner lining of the uterus, and also it can go on and damage the fallopian tubes. And of course, we have the ampulla in the fallopian tubes where fertilization is mostly likely to occur. So when those are damaged because of the interference of the Mycobacterium tuberculosis, then we are going to have this interference, infertility. So it's very, very important to note that amenorrhea is not only the cause of pregnancy, but amenorrhea can come about as certain factors, or even HIV and AIDS also due to its interference with the hormones, because the immune system is going to be directly affecting the hormones production. And of course, in our nervous system abnormalities, also we're going to have lack of hormones, because for menses to occur, of course, we need hormones. It is regulated by the pituitary gland by producing hormones. Now, as well as the amenorrhea, we are going to have other signs of pregnancy. Now, what is frequent micturition? Women in their earliest stages of pregnancy, probably around about 8 weeks of pregnancy, that's towards the end of the first trimester, they tend to experience what we call micturition frequently. And the reason for this, in this case, it's not because of the bladder being compressed as a result of the glowing uterus. Of course, that can come about around about the week 24, or about in the late stages of pregnancy, because the uterus, of course, is going to grow and then it will start compressing the bladder. But in this case, in the earliest stages, while women tend to face this micturating frequency uh, experience, is because of the increased intravascular compartment in the blood vessels. Because as we know, in pregnancy, there's going to be an increase in blood to around about 500 milliliters to 8 to 7 milliliters of blood. And of course, this will bring about the increased intravascular compartment inside the woman's circulatory system. And that means if the increased compartment has raised to a match whereby it is uncontrollable, then that simply means there's going to be a large increase in the glomerular filtration in the kidneys, and that simply means the kidneys are going to filtrate a lot of fluids which are coming in across them. So as a result, that will bring about the increased compartment of increased urine volumes, frequency of micturition as a result of this in the earliest stages. In the late stages, it's going to be the glowing uterus compressing the bladder. And the other thing is the morning sicknesses. Now, almost 20% of women tend to experience the morning sickness in pregnancy, and this tends to happen mostly in the morning, or maybe at around about in the evening during the day. And this is because of the hormone estrogen. And estrogen on its own cannot work. It's going to be stimulated by the hormone called the human gonadotrophin chorionic hormone. This is the hormone which is going to stimulate the production of estrogen in the body of the maternal of the mother. But as estrogen circulates around about the body, it's going to cause the growth in maternal tissue. And the growth in maternal tissue will read about to the cause of the growth of the uterus. And once the uterus is growing, because the uterus is below the stomach, so as the result of the uterus growing, it will start compressing on the uterus on the stomach, thereby pushing it upward. And then when the woman eats, they tend to feel like they vomit, or they tend to feel nausea. because of the same compressed the stomach. But it's not only in pregnant women, because patients with gastritis also can tend to feel that as well. So it is not a clear sign that the woman is pregnant unless we do a test on clinical investigations. So the other thing is increased or elevated temperature, and this is so because of the and this is so because of the increased production in hormone. So for example, because it takes a lot of energy to carry this pregnancy, so the brain is going to sensitize the hypothalamus, and the hypothalamus is going to sensitize the anterior pituitary gland to start producing the hormone thyroid stimulating hormone, and that hormone is going to go directly to the thyroid gland to stimulate the production of thyroid hormone. And when thyroid hormone is increased in the blood, then that simply means there's going to be an increased metabolic reaction throughout the maternal body, and that's will bring about an increase in temperature because of the increased metabolic rate in the body. And not only in pregnant women that this will bring about a rise in temperature, also other patients who presenting with a lot of infections can also have the elevated body temperature as to such women in pregnancy. So the other thing that we are going to talk about is quickening. Now, quickening are early movements of the fetus moving inside the mother's body, the uterus. So those are not the signs of pregnancy. They are the signs of pregnancy that they are, but they are not. We are not really sure that this is pregnant lady which is causing that, because also patients having regular contractions due to certain illnesses can also present with such kind of movements on their uterus or inside their body cavities as a result of these muscular activities going on in their body. So we have accounted for the signs felt by the woman. So for example, amenorrhea, frequent micturition, morning sickness, elevated temperature, quickening, and frequent micturition also. So the next point that we are going to look at now are the signs which are going to be so the signs on physical examination. But before we go on to signs on physical examination, I want to talk about the one point in increment in the increased breast in the early stages of pregnancy. The signs felt by the woman. The woman will also tend to feel the breast begin to itch a little bit like that, and then there will be growth of the maternal breast, and this is because of the hormone estrogen, which is increasing the breast. All the maternal tissues are going to grow. But in this case, on physical examination, the other signs is going to be also what we are going to see is we are going to see the breast changes, of course, but in this case they are more advanced. Breast changes, in this case they are more advanced. Why is it so? Because estrogen is going to stimulate the maternal growth, and as well as that, there's going to be an increased vascularization of this breast, increased blood vessels. So the increased blood vessels will bring about the subcutaneous tissues of the breast being darkened, like dark purplish in color. So that simply means there is a large amount of blood going to that area in preparation for this breastfeeding of the newborn baby which was going to be born. And the other thing is we are going to have skin changes. In this case, we are going to have a pigmentation of the skin, and this is as a result of the hormone melanocyte stimulating hormone. This is the hormone which is stimulating the changes in the skin of the woman. And as well as that, the other thing that we are going to see on this woman who is pregnant, one of the most important things cardinal on physical examinations, the first one is Hagar's sign. Now, Hagar's sign is the softening of the lower uterine segment, because of course the lower uterine segment is there, just there. If you can see properly, there is the fundus of the uterus, and there is the body of the uterus, and there is the cervix. The lower uterine, just above the cervix, there is what we call the isthmus. And down there from the isthmus, the rest of the cervix is the lower uterine segment. So in Hagar's sign, we are going to have the softer tissue of this. But how do we know this on physical examination, that this could be pregnancy? Because of course we are not sure, but we want to see if at all the feelings or the signs that were felt by the woman are truly the cause of pregnancy. So this site is going to be felt by what we call the bimanual maneuver. This is where two fingers of the examiner are pressed just behind below the cervix of the pregnant woman. Either, of course, at this moment we don't know, we are not sure that this woman is pregnant. And when you do that, you also press on the top of the uterus, just above the symphysis pubis, and then you tend to push this finger above you on the top of the on the top of the symphysis pubis. You put it, you push it towards the backwards of the abdomen, and then you will see that you are going to feel the two fingers meet inside as you do that, and that is the softening of this lower uterine segment. And this is because of the hormones, for example, the relaxing hormone. This is the hormone which is going to cause these tissues to ripen, or ripen the cervix as a result of increase in production when there is pregnancy. And these hormones are maintained by this type of hormone, the human chorionic gonadotrophic hormone. So Hager's sign, very important to notice. And once that is done, then you are going to feel the uterus coming on top or towards the anterior side of the abdomen. But there is another sign also. There is another sign called the Jacquemin's sign. And Jacquemin's sign also, this is as a result of increased vascularization of the vulva, because what Jacquemin's sign is the dark purplish coloration of both the cervical mucus, the vaginal mucus, and the vulva itself. So the vulva is going to be darkened in color, and this is because of the increased blood supply to that area as a result of the increased vascularization of that breast, the vulva, because we know that in pregnancy there is going to be an increase in amount of blood. Also, there's going to be an increase in the amount of also the blood going to the vulva. So as a result, we see this darkened vulva in pregnant women. So this is also going to tell us that there could be pregnancy prior doing the laboratory examinations. And the other thing that we are going to notice that also, as well as these two, there is another sign also which is going to tell us that there is pregnancy. And this sign is what we call the Osianda's sign. Probably after the guys that discovered these certain findings. So in Osianda's sign, there is going to be increased pulsation of the lateral fornices on the vulva. And this also is very important because it's telling us that there is an increase in blood supply to that breast, as well as causing it dark, the vulva, but also there is going to be an increased pulsation of that breast when filled. That is in the lateral fornices of the vulva, of the vagina. And as well as that, there is going to be an increase in the uterus. So there is going to be also uterine changes. Now, how does the uterus change? The uterus changes its shape. So, for example, the uterus will become ovoid in shape. It's going to become ovoid in shape. This is its ovoid shape. And also it's going to become the globular in shape also. It's going to change. It's going to grow from its size, actual size, to around about the length of the uterus also is going to change in size as a result of the increased production of estrogen, because estrogen is stimulating maternal growth. So it's going to become ovoid in shape, globular, as a result of estrogen production. So here we have the uterus. And as well as that, besides talking about these signs, there is another sign called the uterine ballotment. And in uterine ballotment is where we have the two fingers also, just as in Edgar's sign. But in this case, we are going to tap the top of the bottom part of the cervix towards, upwards, and then after that, we are going to wait for a bit, and then if there is pregnancy, the uterus will move up, that's the fetus, together with the fetus upwards, and then at just after a short period of time, the fetus will begin descending down, and then we are going to feel it again down. That is what we call uterine ballotment. Now, also on physical examination, we are going to have increased micturition, just like in the early stages, but in this case, it's not because of the increased only because of the increased compartment, intravascular compartment, but also as a result of the growing fetus. Because the uterus is growing, and as the uterus is growing, it will start compressing on the bladder and thus causing frequent micturition. The woman tend to frequently urinate almost all the time. That's what this is all about. And now, having talked about the physical examination, we are going to talk about the true signs of pregnancy. So the true signs of pregnancy, these are based on laboratory findings. So that's number 3. We started off with the presumptive signs felt by the woman, and then we came on along the physical examinations, signs which are objective, the ones that are felt during physical examination. Now we are on 3, the basic 3 findings of pregnancy. The last one is the laboratory, where we are going to test, and then we are going to be sure that there is pregnancy. And these are the true signs of pregnancy. Laboratory tests and other investigations, such as so when we do the laboratory investigations and then we find that the HCG is presence is positive, then that simply means there is pregnancy. Because in pregnancy, there is always going to be the human chorionic gonadotropin hormone, and this is the hormone that maintains the production of hormones such as estrogen, progesterone, other pregnancy-related hormones. It's because of this hormone, and it is present at around about 8 weeks after conception. 8 days after conception. So as early as that, then that simply means there is pregnancy. So in other words, these are the true signs of pregnancy. The laboratory test, because they are the laboratory findings. So they are the true signs of pregnancy. So the other thing is the presence of fetal heartbeat. Of course, when we measure with a stethoscope, we are going to feel this fetal heartbeat. But the fetal heartbeat can sometimes be confused with the uterine sulfur. And the uterine sulfur is also one of the first findings in pregnancy when we are doing the physical examination, because due to increased blood flow to the uterus, there is going to be that sulfur, the soft sound felt, the soft sound which is felt on the maternal blood as a result of the maternal blood coursing through the increased vascular layer of the uterus. But this one for fetal heart is very fast at around about 140 beats per minute. In the uterine sulfur, it's about 80 beats per minute. So it can be confused sometimes, but this is one of the true findings of pregnancy, or in other ways, the positive sign of pregnancy. When we do ultrasound, there's going to be the presence of the gestational sac. And this also would tell us that the woman is pregnant, because there can never be a gestational sac in a woman who is not pregnant.